alaikum warahmatullahi wabarakatuh. Today's article is a prospective cohort study by Lee et al. In 2021 at the Yonsei University College of Dentistry in Seoul, Korea. The article is titled Survival and Prognostic Factors of Managing Cracked Teeth with Reversible Pulpitis, a 1 to 4 year prospective cohort study. A cracked tooth is a condition characterized by incomplete fracture in a tooth that can lead to various symptoms, including pain during mastication, and their aim was to evaluate clinical performance of managing cracked teeth with reversible pulpitis through a combination of internal and external splinting, and to investigate factors affecting pulp survival post-splinting. A total of 34 teeth from 33 patients diagnosed with cracks and reversible pulpitis were treated using bidirectional crack splinting, which included immediate external splinting with stainless steel band, internal splinting involving crack line removal and resin filling, and external splinting with a temporary crown, then finally followed by the final crown restoration. Patients were monitored at intervals of 3, 6, and 12 months, then annually thereafter. The survival of treated teeth was analyzed using Kaplan-Meier survivor analysis, and prognostic factors were assessed using the Cox univariate proportional hazard regression model. And the result of the follow-up, out of the 34 teeth, 21, which is 97%, were followed up to 4 years. The pulp survival rate was found to be 72% after the initial bonding and 91% after the final crown cementation. And for the tooth survival, no teeth were extracted, resulting in 100% tooth survival rate. Although the author mentioned that the relatively small sample size could limit the generalizability of the results, more extensive multicenter studies are to be done to have a better understanding of the prognosis of cracked teeth with reversible pulpitis. For the prognostic factors, the only statistically significant factors affecting pulp survival was pain on percussion with hazard ratio of 11.77. Teeth with pain on percussion at the first visit had pulp survival rate of 46%, while those without pain had survival rate of 94%. So they concluded the bidirectional splinting is an effective managing the cracked teeth with reversible pulpitis. And they added the technique that they used in this study, which they started with the immediate external splinting with orthodontic band. After the clinical and radiographical examination, the affected tooth is immediately splinted with the stainless steel band using a comprimer cement. And the patients are scheduled for a follow-up visit 10 to 14 days later to reassess the symptoms. Then the internal splinting with composite resin filling during the follow-up. If the symptom is re-evaluated, if necessary, internal crack splinting is performed under local anesthesia, and the crack line and any old restoration are removed with visual assistance of a dental microscope. If a shallow crack line remains close to the pulp chamber, it is lined with a flowable resin, and the cavity is then filled with a packable composite resin. Then the external splinting with the temporary crown, if the patient's symptoms are relieved on the day of the internal splinting, the temporary crown restoration is performed immediately, and after 1 month, symptoms are reassessed. If there is no signs of discomfort, a final external splinting, which is the crown cementation, is performed. If symptoms reoccur, the root canal treatment is initiated. And for the final external splinting, if the symptoms resolve after the temporary crown or following root canal treatment, a final crown restoration is placed. If persistent pain occur a month after root canal treatment, the tooth is considered a survival failure and extraction is recommended. And thank you.